All right, so the House of Representatives just had their hearings on Medicare for All, which essentially was just an opportunity for a bunch of different reps to get up and lay out all of the different arguments in favor of a single-payer system as opposed to our largely privatized and for-profit model here in the United States. So, of course, Katie Porter, famous for her whiteboard takedowns, got up there and basically laid out, I think, all of the main high points in the arguments for how completely absurd our current healthcare system is. So I got a couple different clips here, but let's just go ahead and jump into the first one.
If I pay my insurance company $100, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, $17 go to administrative costs. What about Medicare? What do they spend on administrative costs?
That range is about 3 to 5%.
3 to 5%. About 3 to 5%, right here. And if we look at just billing costs, just billing and insurance costs, Medicare is at 1%. Wait, private companies spend 17 times more on administrative costs than Medicare? What are private insurance companies spending on that Medicare is not? Does Medicare spend hundreds of millions of dollars on television advertisements like private insurance does? Dr. Collins?
No.
Does Medicare spend millions of dollars on stock buybacks to shareholders?
No.
Does Medicare spend money on marketing? Private insurance likes to put its name on stadiums and PGA tournaments. Is there a Medicare arena?
No.
Does Medicare spend $23 million on executive pay like private insurance companies do?
No.
We know how much it costs to run a high-quality health insurance program. $1. Out of $100, research shows that Medicare spends 1.1% on administrative costs. We spend $4 trillion on healthcare every year. We could save $200 billion on administrative costs with Medicare for All. And those savings, they could go to expand Medicare. We could spend that money to let patients see dentists. We could spend that money to let patients pay for hearing aids, to help older adults afford eyeglasses, to bring down the cost of prescription drugs, to finally pay mental health professionals for the work they do. Instead, all this money is wasted. We're not talking about paying to keep the lights on in operating rooms or improving the quality of care. All of this money is used to pay big insurance to push paper. It's death by 200 billion paper cuts.
All right, so, I mean, listen, that's classic Katie Porter right there. I think she laid it out pretty perfectly. I mean, she hits all of the main arguments there, but essentially what it boils down to is what system do you think is going to cost more money, right? At the end of the day, no matter what type of healthcare system you have, you as a society are going to have to pay for healthcare. It's just a matter of who do you want to pay for it and who do you want to have the ability to set the prices. And so under our current system, which again, just as a reminder, is the single most expensive, both in a total amount and also in a per capita sense, most expensive healthcare system by far in the entire world, and we have worse health outcomes by many different metrics when compared to other OECD nations. And so it's like, why do we pay all of this money and yet we're getting shit healthcare, shit health outcomes at least? And the answer to that is in all of the different ways in which this massive healthcare bureaucracy is essentially wasting money on shit like unnecessary administrative costs to, process all of the complex webs of healthcare plans that we have within this system, and you have to deal with all of that bureaucratic overload that exists within a privatized and a for-profit model. And on top of that, they're spending money on things like stock buybacks and executive bonuses and payouts to shareholders because they have a fiduciary responsibility to look after their shareholders. And so when it comes down to it, it's just a matter of recognizing that the incentives that come from a for-profit model like that one that she just described are that these insurance companies have a direct financial incentive and a fiduciary responsibility to their shareholders to maximize profits and deny people healthcare. I mean, that's a completely perverse incentive that shouldn't exist within an inelastic market like healthcare. People are always going to need access to this, and so of course you shouldn't fucking stratify this system based on how much money somebody has in their wallet instead of just based on who needs to get healthcare in any given moment. So it's just, a completely ridiculous system. As Kyle Kalinske describes it, you just have an completely unnecessary mafia-like middleman in this insurance company that has basically no other purpose but to stand in the middle of you and your doctor, or you and your healthcare, and shake you both down in this complex process that just drives up costs and doesn't deliver any actual material benefit to our public health. So it's just, again, completely ridiculous and absurd system if you scratch the surface even just a little bit. But there's a second clip here where she basically continues and actually breaks out her whiteboard in this clip to basically lay out some of the main advantages to having a Medicare system. So Medicare for All system. So let's go ahead and jump into this one.
We heard today about the costs of Medicare for All, but there's a cost to letting insurers paperwork patients and providers to death, and that cost of inaction is $200 billion on administrative costs. Now, administrative costs waste money, but they also waste healthcare workers' time. A recent study found that a majority of doctors, 56%, support a single-payer healthcare program. Why? Because today doctors spend only 1/4 of their time with patients. What are they doing with the rest of their time? Paperwork. And I want to add, not only would 50 to 56% of doctors support Medicare for All, but patients would have the most choice under Medicare for All. The health insurance coverage with the biggest network is Medicare. No private insurance comes close. 99% of non-pediatric doctors participate in Medicare. So I want to recap. Medicare for All would save money on administrative costs, $200 billion a year. Medicare for All would give patients the most choices, 99% of non-pediatric providers, and Medicare would let doctors practice medicine. Not surprisingly, given these three things, what do we get with Medicare for All? Better health outcomes. And that's why I support Medicare for All, because I support patients over paperwork.
So listen, I mean, she's 100% right. And there are so many different studies that you can look at that would show that not only would Medicare for All be cheaper than a public option, but also cheaper than our current healthcare system. And also it's supported by a vast majority of Americans. And especially, when you lay out the arguments as she just did, and you just lay out the current state of how our healthcare system operates on this for-profit basis where, 500,000 roughly Americans go bankrupt every year due to medical bills, due to the crime of getting sick or a member of their family getting sick. When you lay out the details of 40 to 60,000 Americans dying every single year because they don't have access to healthcare, when you lay out the expenses associated with our healthcare system, that it's the single most expensive in the entire world right now, there really are just no legitimate arguments against Medicare for All in continuing to maintain our current healthcare system, unless you just literally work for like one of these health insurance companies and you're one of the executives that's making millions and millions of dollars at the expense of the American people. So again, from the economic angle, you would be saving money under a Medicare for All system. The American people on average would have to pay significantly less. Even if you want to talk about potential tax increases that would come or be needed from installing some sort of a Medicare for All system, even those would be dramatically offset by things that you're saving by not having to pay things like premiums, deductibles, co-pays under Medicare for All. So from the economic basis, it just makes sense to switch to Medicare for All. From the human rights perspective, if you believe that healthcare should be considered a human right, as I believe and as I think the vast majority of the country believes, then you should understand that it doesn't make sense to have a system that is stratified and determined by how much money you have instead of how much healthcare you need. So it doesn't make sense from the human rights perspective, doesn't make sense from the economic perspective, and of course doesn't make sense from even the political perspective, because again, it's a massively popular policy. And honestly, looking back, I guess not even back because the pandemic is still ongoing, but I think in the future when we do look back at COVID-19 and the fact that we're now sitting at over 1 million Americans who have died from this one global public health event, we're going to look back at this time and be like, that was one of the biggest political failures in history, is not even not just failing to pass Medicare for All throughout the entire duration of this pandemic, but actually going like backwards in a number of ways. And so not even putting it on the table to have a discussion about Medicare for All. Sure, we can have these hearings and everything, and that's great that they're getting that information out there and everything. But at the end of the day, we haven't even had anything close to a legitimate push for not even just Medicare for all, but even the fucking public option that Joe Biden initially ran on and promised as this like moderate compromise. I mean, have you guys even seen Joe Biden bring up the public option since he was elected? I definitely haven't. And so it's like, we go through this entire global health pandemic, 1 million Americans die, people are going bankrupt left and right just as they were before the pandemic, and we didn't even learn anything. In fact, in the most recent budget proposals that have been put forward, they aren't even including substantial reinvestments in our coronavirus funds. So we are literally right now running out of money to pay for just the basics of maintaining pandemic preparedness, or being able to buy vaccines, or being able to buy masks, and all of the very basic shit that it takes to address a public health crisis. So if anything, we're kind of reverting back, and it's shit like this, hearings like this that are just another opportunity to remind everybody how absolutely batshit insane it is that we do have this type of a healthcare system, and also that we have a political realm that is just completely dominated by entirely corrupted politicians who take bribes essentially, or take money from those gigantic billion-dollar health insurance companies, and then block policies like Medicare for all from ever being enacted. It's nothing short of a crime against humanity.